YouTube, it's my channel for everyday life and Aspie. If you're following me and you're new to my channel, I'm Aspie, and basically I'm all about talking about mental health disorders versus sharing you guys my life stories about and experiences with life in the realm of Asperger's syndrome, anxiety and the like, so that you can get a lowdown pretty much of what I am like as a person underneath these massive diagnoses. Also, I do some motivational kind of videos also for people that are down and out, and hopefully that it will uplift them and encourage them in their everyday life regardless of what they're going through in their day and age. So no further ado guys, basically if you've been following me or are following me as of now, basically I'm trying to, as I said, complete these ADHD and series and all the rest of the series that I had promised you all that you may want to keep an eye out for basically. And at this point of time I'm just trying to do as much as I can before the end of the month, and hopefully before the end of this week especially I'll give you guys a lowdown of where my book is at this point of time if you need to hear more about it. So no further ado guys, this one's all about ADHD and anxiety in children. As we know, basically when it comes down to it, there has been recent debates about how this has all come about, even though anxiety is a mental health disorder in its own worth, even though anxiety also comes into a wider spectrum of other disorders with that anxiety, regardless what it may be it, general anxiety disorder versus your OCD versus basically all the other ones that you can think of that I've shared already. And many people tend to think that regardless of kids with ADHD and that they're always disruptive and they're always rude and everything else, and there needs to be more research into why this is happening regardless of it all. With these disruptive behaviours though that's coming into it of their behaviour, there is a great deal of an overlap between anxiety disorders and ADHD. However, it has been shared about basically also, however, about with ADHD there still needs to be more research, as I shared before, about ADHD and sleep in children and adults alike. But in this one alone though, however, about 1/4 of children with ADHD may also have an anxiety disorder. Likewise, about 1/4 of children with anxiety disorders have ADHD. This may include of all these various types of anxiety disorders that I just discussed just briefly: generalized anxiety disorder, your OCD, separation anxiety, phobia, including social anxiety. Younger children with overanxious disorder or separation anxiety are especially likely to may have ADHD. However, anxiety disorders are often more difficult to recognise, however, and actually, treat. But then again, there are treatments available, as I shared before, with many different disorders that comes about, and this is no-brainer. Especially with this also, though. However, with the can be more difficult to recognise than disruptive behaviour disorders, basically because the reason being behind this, the form of symptoms that are involved into this are usually internalized. That is, they often exist within the mind of the child rather than in such an outward manner, such as verbal outbursts or pushing others to be first in line and the like, as a classic example. An anxious child may be experiencing guilt, fear, or even irritability and escape notice by parent, teacher, guardian, regardless, only when his or her symptoms are likely to be expressed in an actual behaviour such as weight loss, sleeplessness, or refusal to attend school. Will that he or she attract that attention that he or she needs? It is important to ask your child's pediatrician or psychologist to talk with your child directly if you suspect the presence of persistent anxiety in addition to their ADHD. There are things to look out for when it comes down to anxiety and ADHD, pretty much, even though they may come together as comorbid kind of diagnoses or conditions, shall we say, and that sometimes, as I said, this can be difficult to identify an anxiety disorder in your child if they have ADHD, because, as I said before, these symptoms are internal. But because some of the symptoms of anxiety, particularly restlessness and poor concentration, may be misinterpreted as symptoms of ADHD, hence why, as I said before, there needs to be more clinical research regardless what it may be. Children with an anxiety disorder, however, may experience more than a general lack of focus or a restlessness response to boredom. The anxiety and worry are clear-cut, often focusing on specific situations or thoughts. They may seem to be tense, irritable, tired, or stressed out. They may not sleep well and may even experience brief panic attacks here, say involving the pounding of the heart, difficulty breathing, nausea, shaking, and intense fears for no apparent reason whatsoever. While their school performances may be equivalent to that of a child with ADHD alone, they tend to experience a wider variety of social difficulties and have more problems at school than children with ADHD alone. At the same time, they may behave in less disruptive ways than children with ADHD alone because their anxiety inhibits spontaneous or impulsive behaviours. Instead, they may tend to seem inefficient or distracted. Having a great deal of difficulty remembering facts or processing concepts or ideas, your child can be an important source of information that may lead to a diagnosis of an anxiety disorder, however. Although some children are reluctant to admit to any symptoms, even if they are quite significant. If the possibility of an anxiety disorder concerns you, be sure to discuss any fears or worries she has and listen carefully to her response. Report to her comments to the pediatrician or psychologist and encourage her to speak directly with these professionals. But in the meantime, you might need to ask yourself some questions basically, and these are as follows to follow through as we're going through this together. Okay, does she seem excessively worried or anxious about a number of situations or activities such as peer relationships or school performance? Are her fears largely irrational, that is, overly exaggerated or unrealistic, rather than realistic worries about punishment for the negative behaviour that you may be reinforcing? Does she find it difficult to control her worrying? Number 2 of the question is, does her anxiety lead to restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and or sleep disturbance? Number 3, does his or her anxiety or its outward symptoms significantly impair his or her social, academic, or other functioning? Number 4, does his or her anxiety occur more days than not and continue for a significant duration? Has their anxiety symptoms lasted for at least 6 months? Does his or her bouts of anxiety occur at least 3 to 5 times a day or per week for at least an hour or more? Number 6, is her anxiety unrelated to another disorder, substance abuse, or other identifiable cause? A child is distressed over a life event who is abusing drugs or whose family is in a conflict with may exhibit some of these symptoms of anxiety disorder. So to consider these other causes as the reason for anxiety instead of a formal anxiety disorder, however. As a child, did she experience developmental delays or severe anxiety at being separated from a parent, express frequent or numerous fears, or experience unusual stress? Children with ADHD and a coexisting anxiety disorder are more likely to have experienced developmental delays in early childhood and more stressful life or events such as parental divorce or separation. Have others in her family been diagnosed with anxiety disorders? Anxiety disorders can tend to run in the family. It can be hereditary, it can be genetic. A careful review from the family's medical history may provide an insight to your child's condition regardless what it may be. These are some of the symptoms of anxiety disorders, and the presence may indicate a need to have your child evaluated by his or her pediatrician or mental health provider. The sooner the child is properly treated for anxiety, the sooner he or she can improve their functioning and balance their daily life. Like they say, prevention is better than cure. Anyway, the treatment, as we know, there are a wide variety of treatments around for children with ADHD and anxiety disorders, as well as just basically other disorders that comes on top of every other disorder I've shared so far, and they may rely on a combination of approaches get up to each child's specific situation, including educating the child and their family about the condition, encouraging ongoing input from school personnel, initiating behaviour therapy, including cognitive behavioural techniques, as well as traditional psychotherapy, family therapy, and medication management. Behaviour therapies are amongst the most proven and effective non-medication treatments for anxiety disorders. The effectiveness of traditional psychotherapy has been less well studied though, however. Behaviour therapies target changing the child's behaviours caused by the anxiety, rather than focusing on the child's internal conflicts. Cognitive behavioural therapy techniques help children restructure their thoughts into a more positive framework so that they can become more assertive and increase their level of positive function. For example, a child can learn to identify anxious feelings and thoughts, recognise how their body responds to anxiety, and devise a plan to cut down on these symptoms when they do appear. Other behavioural techniques that can be used for treating anxiety include modelling appropriate behaviours, role-playing, relaxation techniques, and gradual desensitisation to the specific experiences that make a given child anxious. Decisions about medication treatment of ADHD and a coexisting anxiety disorder depend largely on the relative strength of each condition, and the multimodal treatment study of children with attention deficit hyperactivity disorder study of large numbers of children with ADHD and various coexisting cognitive behavioural treatments were equally as effective as medication treatment for children with ADHD and parent-reported anxiety symptoms. It was not known, however, how many of those children had true anxiety disorders. However, in general, if your child's ADHD symptoms impede their functioning more than the anxiety does, and a medication approach is recommended, the pediatrician may choose to begin treating her with stimulants first, as the pediatrician will adjust the dosage for maximal effect. They will monitor their side effects such as jitteriness or overfocus, possible responses to stimulants among children with ADHD and an anxiety disorder. If your child's ADHD symptoms improve with the stimulant medication and their anxiety diminishes as well, the pediatrician may want to review their diagnosis to see whether the anxiety stemmed from the ADHD-related behaviour and wasn't a sign of an anxiety disorder. If the ADHD symptoms improve but your child's anxiety remains, the pediatrician may decide to add another type of medication. These medications can include a selective serotonin reuptake inhibitor or a tricyclic antidepressant, but basically it depends on the doctor, and basically at the end of the day, well, that basically ends basically ADHD and anxiety in children. Give me the like for thumbs up for support. Comment below if I've managed to miss anything of importance, or just comment below for how you go about treating your anxiety versus your ADHD. I challenge you guys, so the ones that do have it, so that maybe we can create a well awareness on my channel about this, so that many people can understand others around you. Feel free to sub to my channel if you haven't done so. Feel free to follow me on Twitter, Facebook, AspieAnswersAll. Feel free to share these videos around to your family and friends. So do what you love what you do. Until next time, thanks for support, thanks for watching, and I'll see you again.